Okay, welcome back. I'm so excited to be back where we're talking about going beyond and advising PAs on the appropriate influenza vaccinations for their patients. My name is Jennifer Orozco, and I am the Chief Medical Officer for the American Academy of Physician Associates. And I am joined by three tremendous expert PAs today, PA Takeia Horton, Dr. Sarah McQueen, and Dr. Melissa Soester. And I want to acknowledge that this discussion is supported by Sanofi as we move into influenza season and talk about some really, really important topics that affect all of us as PAs and as providers. I want to shift us a little bit to talk about really the importance of flu vaccine, reducing the severity of complications versus flu prevention, right? And how we talk about that with patients, and some of really what their assumptions are. So I'm sure all of you on this call can say how many patients have heard, or how many providers, right? How many PA providers have heard, I get the flu even if I get the vaccine. So why even bother? And you know, Dr. McQueen, I'm going to turn to you. I want to hear from you. Have you heard this? And if you do hear it, how do you approach that question with patients? How do you answer that in your clinics?
I love a good story. Okay. And that's one way that I relate to my patients. I think family medicine, primary care in general, that's the way we can relate, but even more so in rural medicine. And so I love talking about things that show our humanity. And so sometimes I'll talk about, yeah, but listen, remember when the hospitals were full and it was a really frightening time. And so by taking this vaccine, even though, yeah, you may still get the flu, you may still get sick, you're more likely to save that provider, save that bed for someone else that needs it. I also just really try to focus on, but you might not have to be out of work for 7 days. Your fever may only last a day if you get vaccinated. And so you're back to work quicker. Your kids will be back to school. That usually, that's a winner right there. Get those kids back to school because they're feeling better faster. And so it's really just sharing my own personal experiences about those issues.
Yeah, it's such a good point. And I think that storytelling and really kind of that sharing of not only your personal experience, but even other patients, it is so important to share. And, one of the take homes, I think, is that, a lot of people make assumptions that vaccines are, 100% preventative and 100% effective. And that's really kind of not what vaccines are for and built for, right? They're not 100% effective. However, what they are effective at is helping reduce that severity of illness and severity of complications, especially in really challenging populations that have a lot of comorbidities, right? And so I think if you just took the data from 2009 to 2022, flu vaccine effectiveness ranged anywhere from as low as 19% to really as high as 60%, with about an average of about 43%. And so I think it really just highlights that conversation with the patient about how we're not talking about taking flu to prevent the flu, but really to reduce complications if they were to get the flu, and how to tie that back to their health and how important that is for themselves and their families. So, and I have a lot more statistics that I can share, but I was hoping maybe, and maybe Dr. Soester, we'll start with you. Could you share with us maybe an example of a patient interaction that you've had like this, where you really have a patient that has a lot of comorbidities and just does not want to take the flu vaccine because they just don't think it's going to work because it's not 100% effective. So how can you engage with them, and what is your approach?
I think a lot of it for me has always come down to having individualized conversations with patients. And you can show them the data from, the CDC and other sources, but for them, they want to know, well, I'm a type 2 diabetic, or I have metabolic syndrome, or maybe I've had a heart attack in the past. what do my risks look like? You know, they don't want to see what it looks like for the general public. They want to see what it looks like for them. So I like the idea that Dr. McQueen brought about too with storytelling, because a lot of times individuals maybe haven't had influenza severely, you know, bad enough that they had to be in the hospital, but maybe they've known somebody that has been. And a lot of times when you really talk to them about what their experiences have been with influenza, how sick have they been? And maybe if it's been a few years since they've had it, they may have forgotten that. So letting them know, hey, remember the time when you had this illness, remember how sick you were, remember, like we talked about, you had some kiddos that had to stay home from daycare, or you had family members that were really ill. So for me, a lot of it's just individualizing it based on their medical history. And that's where I think PAs can play a huge role in this. PAs tend to spend more time with their patients and really know a lot more about their history, and can talk to them about what their individual risks might be and what vaccine might be most appropriate for them.
One of the statistics, and I'm going to go through a couple of statistics here because I think that they're really impactful. And flu vaccination has been associated with reducing hospitalizations among people with diabetes by 79%. And that's a huge number, right? And if you look at some other statistics here, during the most recent flu season, 9 out of 10 people hospitalized with the flu had at least one underlying health condition. 9 out of 10. And specifically during the 2022 to 2023 flu season, almost 64% of patients hospitalized for the flu had hypertension. Around 44% had some type of metabolic disease, and over 40% were obese. So there's a lot of important data points that are out there, to your point, that people can relate to, but it really is that helping them understand the why and the story associated with it. And PA Horton, you know, I want to turn to you for a second, because you have some of the most vulnerable populations that you've worked with, especially with some of your HIV work and some of your National Health Service core work. So tell me what has been your approach to some of those patients, and what do you share? What do you say to them when you're talking to them about the flu?
The most common thing I get from people is, well, I got the flu vaccine and I was sick immediately after, and it gave me the flu. And when I try to explain to them, I was like, the flu vaccine, or any vaccine, is kind of like an email sending your body a cheat code saying, hey, there's this foreign body in my system and I need to learn to fight it off. So you may develop fever, chills, or a little bit of like fatigue, but it's not that you have developed the flu. That's your body's way of saying, hey, this is a foreign substance, I need to fight this off. And now once you've done it after the vaccine, you'll have a better immune response if you come into contact with the flu. And I think that's a good way to explain it to people, because their concern is always, well, you're giving me the flu. No, we're giving your body a way to fight off the flu if you come into contact with it. And I think with really vulnerable populations, patients with comorbid conditions, hypertension, diabetes, you know, when you really think about it, there may be times that they don't have access to healthcare. They can't get transportation to the clinic. They may not have access or financial means to pay for their meds. So what has been really influential is helping to find those resources for people, working with the health department, working with other community organizations, putting on health fairs so that patients don't always have to come to you. You can also go to them.
And we know as healthcare providers who deal with this, that flu season can start really early and it can last really late, and that the season changes depending on what strain of the flu, what type of, you know, and so I'm sure all of you have heard of this. So Dr. McQueen, I wanted to turn to you and see, have you heard this? And what do you say to people who say, well, it's a little too early. I'll see how it goes, and then I'll let you know. And how do you talk about that kind of urgency with them?
Absolutely, I've heard that. And I think we even sometimes do it ourselves, because you have this gamble of, gosh, I really don't want to have flu when I go on spring break in March, but I want to be able to go to Thanksgiving. So we do it. We're trying to time it ourselves as practitioners. And so when I see patients, I always stress that, listen, it's better to have it now. And the CDC is even clear that September and October is kind of that encouraged sweet spot of getting those vaccinations done. And really even looking at the kiddos, especially the ones that this is their first vaccination season and they have to have two spread out a month apart. You're going to want to start that early so that they're fully protected by the time it really picks up. And thankfully, I usually always have a case or two by now, which is true this year already. And so I'm able to go, nope, it's already here. We're going to do this now before you forget or before it's too late. And so I just have those types of conversations.
Anybody else have a story or something they want to share kind of about the urgency with their patients, and or, you know, someone who wasn't urgent and kind of what happened and for waiting?
Always just tell them, start getting it when it's available. You know, if you've got it in your clinic and you can give it today, let's get it today and not put things off, because it's so easy to get busy with other things. And you want to have that good immunity in place really before the heat of influenza season gets there.
Especially if you're going to have get-togethers for the holidays, for Thanksgiving, for Halloween, you want to make sure you're protected early.
And I'll tell you, I have I'm a mom of 3, and I have been caught in the, oh my gosh, I got to get all these kids to go get their flu vaccine, and what is the most efficient and the easiest way, and how can I get them all done at once? And there's been times the pediatrician is, you know, I have no more, right? And so there's always, you never know what's going to happen, I think, during influenza season. Everyone's back in school. We just started school again, right? And all of a sudden we've seen this uptick in the viruses going around, which is a normal part of school. And I think it allows people to say and understand that we're coming into the season. So might as well just knock it out and be done with it. And I think everything that you're saying is so true. Well, thank you so much. This has really been a great discussion, and we're going to continue to talk about this and continue this conversation about how we are continuing to go beyond and how we can really empower all PAs to recommend flu vaccinations for their patients and why it's so important. And up next, we're going to talk about the right influenza vaccination. So I hope you'll stick with us, and I'm excited to talk about this next part.